Did you know that over 20 million people undergo cataract surgery each year? That's right, a staggering number. But what if I told you that there are 5 common secret side effects your cataract surgeon may have never mentioned? Today, we're going to uncover the hidden truths behind cataract surgery, revealing the shocking side effects you need to be aware of. So, if you or a loved one are considering this procedure, you won't want to miss what we're about to uncover. Cataracts are opacities that form within the eye's lenses as a natural part of the aging process. When individuals come to me for a consultation regarding cataract surgery, we engage in thorough discussions about the potential risks associated with the procedure. These risks encompass complications, such as prolonged inflammation and infection, along with the possibility of requiring further surgery as a result of the initial procedure. It is important to emphasize that cataract surgery has the power to bring about life-altering changes. The number of delighted patients I encounter post-surgery is truly remarkable, and they often express their regret at not having undergone the surgery earlier. Nevertheless, numerous potential complications and adverse effects may arise following surgery, making it impractical for your surgeon to spend hours discussing every single scenario with you. Thus, in this video, I aim to unveil 5 essential aspects about cataract surgery that your cataract surgeon, including myself, may have neglected to inform you before the procedure. Confidentially, the first secret pertains to dry eyes, which are experienced by virtually every patient after cataract surgery. Surprisingly, a survey study revealed that 42% of patients reported experiencing dry eye symptoms post-surgery. The causes behind this phenomenon are multifaceted and varied. To begin with, the eye drops utilized following cataract surgery generally contain preserved liquid that may lead to dryness in the eyes. Additionally, inflammation frequently occurs after undergoing cataract surgery. Inflammation affecting the surface of the eye is a prevalent factor contributing to dry eye, and this particular form of dry eye typically worsens once you discontinue using anti-inflammatory eye drops a few weeks after the surgery. Lastly, during the surgical procedure, some of the nerves in the cornea are severed, resulting in a loss of corneal sensation. Corneal sensation plays a crucial role in stimulating tear production, initiating the blink reflex, and generating growth factors to facilitate healing. Did you know that one of the hidden consequences of cataract surgery is droopy eyelids, medically known as ptosis? Surprisingly, this condition affects approximately 21% of patients who undergo the surgery. While some cases of droopy eyelids may be temporary and related to post-surgical dry eyes that eventually resolve, others can persist over time. The culprit behind this unwanted effect is often the eyelid speculum used during cataract surgery, which, although necessary, can inadvertently stretch the eyelids. If you already have droopy eyelids, it's important to note that cataract surgery can exacerbate the condition. Therefore, if you have plans for eyelid surgery, it is advisable to wait until after undergoing cataract surgery. However, if you're seeking a temporary solution to address droopy eyelids before pursuing eyelid surgery, there is an option to consider. Upneek, a daily eye drop, can provide short-term relief by assisting with droopy eyelids. This could serve as a stopgap measure until you can proceed with the desired eyelid surgery. Unwanted visual phenomena, commonly known as dysphotopsis, are a frequent cause of patient dissatisfaction following cataract surgery. Positive dysphotopsis manifest as an arc of light appearing at the periphery of one's vision, while negative dysphotopsis present as shadows or darkness in the same region. These effects stem from the design of the intraocular lens implanted to replace the cataract, and despite continuous advancements in lens technology, many patients still encounter them. Fortunately, in most cases, these symptoms tend to fade away gradually over a span of weeks or months. Although they can be bothersome, individuals generally learn to adapt to these occurrences. In instances where dysphotopsis prove troublesome and disruptive, Doctors may explore various options, such as prescribing eye drops or glasses that can constrict the pupil. However, it is worth noting that the utilization of these interventions is infrequent. Alternatively, as a last resort, and with utmost caution, a physician might consider exchanging the existing lens with a different type through a procedure known as intraocular lens exchange. It is important to emphasize that this surgery carries significant risks and should only be undertaken as a final course of action. Floaters are surprisingly prevalent, even more so than one might imagine, and tend to manifest more frequently following cataract surgery. There are several factors contributing to the occurrence of floaters after this surgical procedure. If you have not experienced a condition known as vitreous detachment, where the gel-like substance called vitreous that fills the inner part of the eye separates from the retina, the delicate vascular lining of the eye, you will likely encounter it post-surgery. This occurrence often leads to the emergence of floaters and slightly elevates the risk of retinal tears or detachment. Furthermore, another common cause of increased floaters is the presence of eye inflammation within the eye that underwent surgery. This inflammation can give the impression of floaters in your vision and may result in a temporary upsurge in the number of spots you observe. Every individual develops a certain amount of scar tissue behind the newly implanted lens in the eye. Surprisingly, around 30 to 50% of eyes eventually require laser intervention to eliminate this tissue. The appearance of this scar tissue can vary, ranging from shortly after the surgical procedure to several years later. This scar tissue is commonly referred to as a secondary cataract due to its resemblance to cataract symptoms. The initial signs include nighttime glare and a decrease in vision quality, followed by a general blurriness in vision. Fortunately, the treatment for this condition is swift and involves the use of a YAG laser, which produces instantaneous results. Once you undergo this treatment, there is no need for further interventions. I trust you found this video to be beneficial. If you derived pleasure from this content, kindly show your support by liking and subscribing. I eagerly anticipate connecting with you in my upcoming videos.